Hello and welcome everyone. My name is Latasha Hewitt, Communication Director for Allegheny East Conference, and we're so happy that you joined us this afternoon for a very important discussion. We're looking at the big picture, a discussion about COVID, and we have a wonderful panel with us today. And we're going to ask them to introduce themselves, tell us a little bit about them. We're going to start with Dr. Irving Westney. Please tell us a little bit about yourself.
Blessed Sabbath, everyone. Hello, my name is Irving Westney. I am an emergency physician. I trained at University of Maryland many years ago. Did my residency at Detroit Receiving Hospital, and I've been practicing as an emergency physician for the past 25 years. Over the past 3 or 4 months, I have had the privilege of working at an endemic area in northern Arizona with the Navajo Nation, and I have treated a number of COVID positive patients in many, in all aspects of this process, and so it has allowed me to have a little bit of experience in dealing with this condition. Thank you very much for the opportunity to
Thanks
be
for
with you.
being here. Thank you.
Thank you.
All right, Dr. Patrick Crary.
Well, good afternoon and happy Sabbath to you all. Um, my training initially was in emergency medicine. Trained in emergency medicine and then practiced that for about 18 years, at which point I switched over to occupational medicine, which I've also been doing for about 18 years. God has blessed me now in the position that I'm in right now, in that I'm the medical director for Concentra Center for Prince George's County. So the police, fire, EMTs, all of the government officials that are needing any kind of physical help or medical assistance, those are my patients. So I've also had some experience in dealing with people who have been exposed to COVID. In fact, one of the people in my office had COVID.
Mm.
We've also had to deal with people trying to get back to work after they've been away from work, and the whole process of going through that. But we're here today to see how we can share with you information that can help you have a further understanding of what's going on and how we as a people and as a church need to move forward in faith.
Amen. Thank you so much. All right, and lastly, Dr. Milton Brown.
Hello, all. I'm Milton Brown. I have a PhD in organic chemistry from the University of Alabama in Birmingham and an MD from the University of Virginia School of Medicine. I've spent 20 years of my life developing new medicines, including now medicines to treat COVID-19. And I'm currently a professor of practice at George Mason University and CEO of Trocar Pharmaceuticals.
All right, great. Thank you. So, as you all can see from their descriptions, you know that we have a well versed panel here, and we're happy that they consented to share with us today. They're also part of the AEC family, and so we welcome them home in this broadcast. And before we get started with our discussion, we are going to open up with a brief word of prayer. So please bow your heads with me wherever you are. Father, we just want to thank you for the blessing of a new day. We thank you for this Sabbath. And Father, we also thank you for the knowledge of this panel that they are willing to share with all of us who are listening. We know that you desire for your people to know what's going on so that we can make wise decisions. And we ask that you will be through this with us through this discussion. Help everyone to learn something that will help them to be safer as we deal with this current crisis. In Jesus' name we pray. Amen. All right. And for those of you who are watching, please feel free to share the stream with others so they can get this information as well. And we're going to jump right into a few of the questions we have now. If you viewing have questions, please put them in the chat. We'll try to get to as many of those as possible. So as we're looking at COVID, we've seen a lot on the news, and sometimes it's still a little unclear about how pandemics really work and the historical scope of them. Dr. Crary, can you kind of give us some context of how pandemics typically work and how this one fares in comparison to some of the others?
Sure. This is some interesting things have happened in the world relative to pandemic illness. Many of you have heard that the only year in which something other than heart disease was the #1 killer worldwide was in 1918, when we had the pandemic that took place at that time, where approximately 70 million people around the world died from this horrible infection that took over, and there were no treatments or any way to deal with it. So it became a worldwide thing. Well, in January, we got the first hint that there was something going on here. And shortly after that, the World Health Organization said that this was going to be a pandemic. Of course, we found out it started in Wuhan, China. Truth be known, we've had coronaviruses around for a while, and corona, if you look at the electron microscopic picture of the virus that you've seen, you have a ball and it has all these little spikes that are sticking out from it all over the place. And I think that the reason why it got that name is because those spikes kind of remind you of a crown. And that's what corona stands for. It stands for a crown. These viruses in the last, I'm going to say the last 20 years, have popped themselves up at different places. Back in early 2000, there was SARS virus, hung around for a little while and then kind of went away. Soon after that, the MERS, or Middle Eastern Respiratory Syndrome virus, came out. I think that was 2011. It was close to Mecca when that happened, and a real scare went around the world because 11 million people come from all over the world to go to Mecca. And this virus was just breaking out, which had a 30% kill rate. Out of every 100 people who got this, 30 people died. Pretty vicious virus, but it kind of died out and went away before all of that got around to become a world pandemic. It went away. However, this situation that started this year has developed into a real nasty illness. It started in Wuhan and then got to us. We probably were not as quick to deal with it because we really didn't understand much about it, and we still have a lot that we don't understand. Since then, of course, you all know that we've gone to several different methods to try and combat this virus. The most successful has been having people self-quarantine so that they're not exposed to people who have it. The problem with the virus is still some of the problems that we don't have real answers to. We know it's passed by droplets. We know that if you're around people that are sick, the likelihood of you getting it, if you're not protected, is very high. We also know that the death rate, which they originally told us was going to be 2%, has turned out to be closer to 5 to 6%, which, when you think about things like flu in the country, about 20 million people get the flu every year. And of that 20 million people, 38,000 people die. Well, if 20 million people get this particular virus, over 600,000 people will die. That's a big difference. And a lot of people have tried to compare this to the flu. This is not the flu. This does not affect you like the flu. And it's a very highly contagious virus that can really penetrate areas and people and populations quickly. So we have to give it that kind of respect. As we talk to you today, you'll hear that. That's a general overview kind of what these type of coronaviruses are like. They've been around a long time.
Okay, great. That was very comprehensive. We appreciate that. And so, Dr. Brown, can you help us understand, this virus? It seems so complex, as you described Dr. Curry as having the different crowns, and how does it operate, Dr. Brown? How does this thing get inside of us, and how does it take reign there?
Latasha, this is for our listening audience, this is a virus that's very has a very interesting way of penetrating our cells. If you were to hold your hand like this and stick out your finger, That finger we call the spike protein, and it sticks itself into another cell. And when it sticks itself into the cell, it allows for the virus to be encapsulated inside of the cell. So the virus itself is now resident inside of your cells. What does it do first? The first thing it does is that it locks the door. It closes the door so no other viruses can get in. And then it begins, once it's locked the door shut, it begins to replicate itself and make many, many members of its own self. Once it's completed that, then the members of the virus go around the cell and it begins to take the valuables of the cell. In fact, it turns off the sprinkler system and the fire extinguisher inside of the cell so that the cell cannot put out a fire. Now, guess what it does once it turns the fire extinguisher off? It starts a fire, a really bad fire. Now the cell is trying to fight the virus and put out a fire. Now this fire, we use these words just as regular words so that we can understand it's something that is attacking us. The virus sees another door. It goes in another door and it sees kerosene. It throws kerosene down on the floor and it lights that fire. The problem is the cell doesn't have a response system because the virus hasn't activated the sprinkler system, so it cannot put out the fire by itself. Now, when it throws this kerosene down and it lights a really hot fire, we have a name for that, and we call it the cytokine storm. And it allows for the attack of other houses, and they begin to burn. And before you know it, you have multiple fires. This virus that starts out as, and you'll see some clinical evidence of how it starts. If you ingest it orally, you get an infection of the stomach, of the GI system. If you inhale it nasally, you get an infection in the lungs. And so at first we thought this was an infection, a respiratory infection of just the lungs. But now we see that patients, 49% of patients who have respiratory symptoms like diarrhea, nausea, vomiting, and they have the respiratory problems, they have a poor prognosis of survival. This virus is what we call virus. It attacks the GI, it attacks the heart. About 30% of patients that present have heart attacks. Young people. We're finding that in some cases in the ICU, at least 80% of the patients have to also be placed on dialysis. And the reason is because the virus also is attacking the kidney. So it's attacking the lung, the stomach, the gut, the heart, the kidney, the liver. Now we're seeing patients as young as 20 years old coming into the emergency room having seizures. It's attacking the brain. And recently there was a summary, and we'll talk about this later, there was a summary of young people, of kids, 5 to 10, who are having abnormal inflammatory reactions when they are infected with COVID-19. And although they fully recover, it takes a long time, and they have to be treated with high-dose steroids and convalescent plasma. But what disturbs me from last week is a finding that we found from Wuhan, China, that patients have in their sperm, they're asymptomatic, but they have live COVID virus in their sperm. So this now places this virus as a sexually transmitted virus. You have no symptoms, you have no fever, but you have live virus in sperm. This changes the game for the infection and what will happen to the infection rate in this second wave. And we'll talk more about that. But I want the listeners to understand that this is more than just a respiratory virus. This is a virus multi-organ: lung, gut, heart, liver, kidney, brain, and sexually transmitted.
Wow. Yeah, absolutely. Thank you for providing that scope, because I don't think many of us recognize, as you said, that it impacts so many of those things. And before we look at some of the other questions, of course, people are anxious to know what they can do to combat this and build their immune systems. But Dr. Westney, I'd like for you to speak a little bit about how all of this impacts us as a conference in terms of our communities and what we need to do to protect ourselves against this.
Thank you very much once again. Blessed Sabbath, everyone. I want to start by saying, as I said, I've been doing emergency medicine for the past 25 years. About the end of the year, one of the staffing companies that I work for said to me, would you like to work in northern Arizona on a Navajo reservation? And, I thought it might be good to see the Grand Canyon. Never been there. So I went ahead and said yes. I started working at this facility the end of February and became acclimated. And I have made 5 trips to this point back to this facility. At about the second trip, we started to experience a number of COVID cases. And as a result of this experience, I have come to realize how severe and significant this problem that we're dealing with is. And as I saw the effect that this virus has had on that community, and by the way, I should tell you that community, although we talk about New York and we talk about New Jersey and the concentration there, this area is right behind New York and New Jersey as far as concentration and cases per capita. So I was able to see its effect on that community there. And as a result of that, I immediately thought back to home about, my family and my extended family and the effect that this could have if we don't take this seriously. I can tell you that this weekend in northern Arizona, everything is locked down on the Navajo Nation. You can't go to Denny's, you can't go anywhere. So while places are opening up, in places that are really affected by this, they're completely shut down because they know exactly what's happening to their community and they're doing what they can. I want to express it's what's happening. We see states opening presently, and we're trying to make sense of that. But we need to realize as a people that there are political and economic influences that are occurring right now that are outside of what is in everyone's best interest. And so while I think we need to be careful on a personal level, we need to make good personal decisions, but we also need to make good decisions as an extended family and trying to look out for each other. So I would like to try and, Dr. Brown talked about a fire. I would like to try and show that fire. And that's what I've seen. So if you could put the first slide up. This is a slide of a normal chest x-ray. And the little white thing you see in the middle is the heart. It's a little round there, yeah. And that's the trachea that you have the pointer on, the aorta. If you look, you can see the heart is, the border of the heart, the white area in the middle, is distinct, and you can see the outline of the lungs clearly, and the lungs are generally, dark in appearance. You go to the next slide. as you know, so when I first started going to this area, I noticed, everyone was everything was fine, and then all of a sudden, it was almost like, my analogy is popcorn. All of a sudden, the Jiffy Pop popcorn exploded, and we saw a number of X-rays that looked like this. And this is what you call bilateral infiltrates. You can no longer see the outline of the heart. The lungs no longer look dark. They are kind of light in appearance. If you look more on the right side, there's more of an abnormality on the right side, on the patient's left side, but on the right side of the picture. And on the left side, you can see a little bit. We call this bilateral infiltrates. And what this is showing is what Dr. Brown was describing. This lung has become infected by the COVID virus. And this is the picture that you see. And when patients present, they present with shortness of breath. They'll also present with something which we call exertional dyspnea, which means when they walk, they become very short of breath, even more short of breath than they were at rest, because their lungs can't keep up with the oxygenation needs of their body. These lungs are fighting both a virus, and they're also fighting an inflammatory process. So when we see these patients, they require supplemental oxygen, and then we have to decide, whether or not they require enough oxygen that they require admission or, further intervention. And that's what I was seeing throughout the community as patients were coming in. And I should also add that, I'm talking about this area in Arizona, but it really is a analogy, or it is a description of what we are seeing in our own communities. I was an emergency physician at Adventist Healthcare for many years, and I have many colleagues who are still there. And they are telling me that we are seeing, case after case of COVID in PG County, in Montgomery County, in Howard County. In PG County presently, there are 10,000 cases, almost 11,000 cases presently of COVID. And unfortunately, we're familiar with that. If you can go to the third slide quickly. The third slide shows, this is a patient who required intubation. In the very middle, you can see a little, kind of like a straw. Go to the middle, a little further. Yeah, there you go. Up a little bit. There's a little straw in the middle with a little white line. There you go. And that is an endotracheal tube. So this patient, was his lungs. You can see that there's we call it whiteout, but there is inflammatory / infectious processes occurring in both lung fields. And this patient required more than supplemental oxygen. This patient required mechanical ventilation. And what we have found is that when these patients require that, their prognosis is very poor. So initially, we would treat these patients with intubation, but the push for ventilators has gone away, because we find that in addition to the inflammatory process, in addition to the infectious process, you have an inflammatory process, and these patients don't do well with positive pressure ventilation. So the other thing I'd like to say is that, as a medical specialty, we've been learning how to better manage this infection or this disease process, but it's been a learning process, and that's what we've been dealing with. So this is what I wanted to put a picture on, so you can see. Some people say a picture is worth 1,000 words. This is what COVID looks like in your lungs, and as Dr. Brown and Dr. Curry expressed, the lungs is just one system. It's affecting the heart. It's affecting the kidneys. It's affecting the liver. It's affecting the GI tract. So this is a multi-system organism, or a multi-system condition that is one of the things that makes it so so serious. And the good news is everyone doesn't get this, but we don't know who's going to get this and who's not going to. So that's why it's so unpredictable. I think I'll leave my comments at that for questions, but I want you guys to see this is the visual appearance of what we're dealing with, right? I just say this. There are some people who are I've been seeing on Facebook and various places, some people saying this is a hoax. This is not no hoax. Okay. And that's why I want you to see that picture, because this is no hoax. It's not fake news. This is real, and it's affecting us. So I think it's imperatively important that personally and on a church-wide level, regional level, we make decisions that are in our best interest.
Absolutely.
Could I add one thing to that? Sure. There is a condition that they've discovered also recently that goes along with this. It's called asymptomatic hypoxemia. I know y'all are saying, what in the world is he talking about? Well, the word hypoxemia is a big word, but really means low oxygen. But the body is phenomenal. This body that God has created in us is amazing. Your saturation levels of oxygen can drop significantly before you even realize that it's gone down and the need that you have. So why am I bringing that up? Because when you first get the symptoms is when you need to go in. Don't wait until you can't get to the bathroom, or that you can't walk across the room, or you can't climb a flight of stairs. At that point, the virus has already taken a stronghold in you. Go and get treated. Go and get checked. Go early. There's never been a line in a medical book that says the later you come, the better it is. Doesn't exist. Get the help at the earliest sign that something isn't right, especially if you've been diagnosed with having the virus.
So, Dr. Curry, I hear you say that, but I've heard individuals say that they have gone to the hospital and they felt like something wasn't right, and sometimes they're turned away. How do we deal with that situation where you're not sick enough?
You have to remember, it's a 6% rate. That it means if 100 people get it, 6 people will die, but 94 will get better. The hospitals are overwhelmed with that 6%. So unless you're very sick, you're not going to stay. If you have the virus and you've been diagnosed with the virus, but you don't have the plethora of symptoms that come when this virus begins to take you over, they will have you go home. They'll say, go home, quarantine, stay away from your family. And if you need guidance on how to do that, we're happy to share that with you as well. And stay away from your family and stay away from others for 14 days, basically is what they're saying. That's the length of time that this needs to run its course. However, now they're finding people even after the 14 days are still shedding virus. So there's all kinds of things that we don't know anything. We don't have a good grip on still, because we don't know if after you get this, if you're immune. Apparently not. There are studies that indicate that even after you get it, you can get it again. Why? Because there's several different strains of the virus. So they're not going to keep you in the hospital unless you have to stay in the hospital. But don't wait. If you start feeling those symptoms, shortness of breath, or have severe diarrhea, nausea and vomiting, or you can't smell or can't taste, these are things that are letting you know that this virus is getting a hold of you and you need to get someplace where you can be seen. And if you go home and you sense that you're getting worse, go back. Don't be afraid to go back, even if they've told you to go home, because this is a progressive thing. It doesn't progress all the way out in everyone, but you don't know if you're that one or if you're one of the 96 that's going to get better. So when you feel that you're changing, that it's changing and getting worse, go and get help.
Right away. Okay, I want to ask a question. You guys have done a great job of, helping us understand how serious this really is. So a question came from one of our viewers. if it is this serious, then why isn't it being viewed or treated like diseases such as cancer, like colon cancer and pancreatic cancer and other stage 4 cancers? Why doesn't it seem to have that same, um, viewpoint? Why aren't we looking at it as seriously as those diseases?
Well, I'll start with an answer. Um, we are treating it even more aggressive than we're treating cancer. In fact, the budgets that were used to make medicines and therapies for cancer, all of those budgets have been moved over to address the need of developing therapies and vaccines for COVID-19. Um, the medical community is taking this extremely serious because this is a disease that we're going to deal with not just over the last 3 months, and not just for the next 3 months of the summer, and not just for the next 3 months of the winter. We're going to be dealing with this virus into next year, and the issues in regards to taking it serious have to do more with a mindset of the people, and not the people who are trying to fight this disease. Those like Dr. Irv Wesley on the front lines, and seeing the patients come in with the virus. We're all taking this very serious. This virus nothing has happened that has changed with this virus for it to go away. There's nothing that has happened.
If I could just comment,
Sure.
Dr. Brown. Yeah, I would like to say that this virus is, I think there has been there are mixed messages that are being sent. And as I expressed before, there are political and economic factors that exist that are clouding the picture. Now, what I will tell you is that I have, I have colleagues at this facility where I'm working at who have become positive. I have one colleague who had to be intubated and in the ICU for a number of for weeks. She finally came off the ventilator. So for anyone to say we're not taking this seriously, it's just once again a misconception. This is as serious as it can be, and that's why once again we need to make sure that personally and as a community we make good decisions.
Absolutely. Thank you for debunking that myth. And Dr. Brown, just going back to a comment you made, I think it raised a lot of eyebrows when you mentioned that this could now be considered a sexually transmitted disease. So the question came up, does this affect the gestational process at all?
It's possible. We don't know. This is called the novel. I want people to understand that word, novel, new, just understanding it. As of a week ago, we had no clue that it was that asymptomatic people had live virus in their reproductive system. We didn't know. So can it affect the gestational period? I'm sure. I've seen various reports of women having, normal childbirth and being infected with the virus. Some have gone into coma during the process of having a child. So we're learning right now about how this virus will affect the gestational period of the unborn.
Okay.
But it's a very good question. It's one that we'll learn over the next, 6 to 8 months. We should probably have a real understanding of how it affects the gestational period.
Okay, thank you. Now you talked about vaccines, some something being developed to help slow this virus down. Where are we with that? And how soon can we expect to see something being circulated in the community?
Well, I'll take a first shot at it, and then my clinical colleagues can also chime in. The vaccine, you remember I told you to put your hand out and make a fist and point your finger, and that's the spike protein that sticks into the cell by the virus. They're making vaccines towards that spike protein, and because they feel like that's the attacking point of the virus. The problem, Tasha, is this. If the virus is a key and your cell is a lock, when you come home, it's just one key for your lock, right? You have copies of it, you give your family, your kids, but they all the same key, and they fit the lock, and you open the lock and the door opens. Well, imagine this. The virus has 5 or 6 different kinds of keys that it can stick in the lock and open the lock. So picking a vaccine for one of those keys will be really, really tough. And if you multiply that by the number of cousin viruses that exist, or mutant viruses that exist of COVID-19, the task at hand for making a effective virus is going to be really tough. I mean, we still don't have a vaccine for SARS-CoV-1, right? SARS-CoV-1 back in 2002. We still don't have a vaccine for the first emergence of this virus, the cousin to COVID-19 or SARS-CoV-2. So developing a vaccine, we won't see a vaccine in the time frames that we're talking about. What are the important time frames? Okay, we have school in the fall. We will not see a vaccine that's effective and safe by the fall. We may not see a vaccine that's effective and safe until next summer. And so there are some challenges that we have. What you hear, what Dr. Westney said, there's some political and economic backtones of people saying we're accelerating warp speed development. There's no warp speed development. You can't cut the steps. Mm-hmm. The vaccine has to be safe first. Then it has to be effective second. Then it has to be effective in a large group of people third. And so those steps have to be followed in order for us to understand, will this be an effective vaccine for the different types of COVID-19? We had one come from China that came in through the West Coast. We had one that came from Europe that came into New York. And we don't know, and we don't believe that they're both the same virus, but they're different flavors. Mm-hmm. And so having a vaccine that will be effective for all of them, I'm not sure we're going to have that very, very soon.
And let me add to that, to Milton. Very good point. And the question is a worthy one, in that, we're getting a lot of mixed messages. However, the Brits are probably closer to developing a vaccine than anybody that we know of so far. They've been working on it for 10 years, okay? Mm-hmm. And they haven't been able to figure it out yet. So we're really giving you a hopeful a dream that this is going to happen. It's going to happen by sometime next year. Because that's the time it usually takes to develop and get a vaccine process through the regular system that we have in this country to make sure that it's effective, it's protective, and it's safe. So, I just want to throw it out there for you to be aware. we may be dealing with it longer than that.
And Dr. Curry, there's another issue of amount. So if you go to Bill Gates' conversations about the amount of vaccine, the number, we're going to need at least 8 billion vials of vaccine in order to cover this problem that we are facing, this virus that we're facing, and the amount of sheer making enough vaccine for the world is going to be a problem.
And of course, with all the suspicion that people have, the other problem is how many people are going to step up and have vaccine administered to them.
Right. Good point. Yeah, I think we lost him. But, you know, that being said, you're making it very clear. We can't rely on this vaccine in terms of, you know, whether or not how we deal with COVID. We're going to have to live with COVID for a little while. So how do we, you know, with states opening back up, how do we keep ourselves safe? What are your recommendations to just the individual about how they can keep themselves and their families safe in the midst of this pandemic?
If I could jump in here, I would take the first shot at this. There are a number, first of all, the CDC provides a wonderful website with significant amount of information. Talks about making decisions for yourself and for your congregations, if it were. But those decisions are based on figuring out the level of cases in your local area. And there are COVID-19 trackers that are available online. If you go to Google and you go to, you put in as a search COVID-19 tracker, Bing.com has a wonderful website which cones down to the county level how many cases are occurring and when they're occurring, and lets you see what the trend is. If I could just share a couple slides to if that's okay at this point.
Go right ahead.
Okay. Let's see here. One moment here. This is an example. Can you see? This is an example of Maryland. I'll just use this one, although you can do it for any state. Pennsylvania, New Jersey, Virginia, West Virginia. These are the states in the Allegheny East Conference, as well as Delaware. I'm just going to show Maryland because that's where I live. But I did search Pennsylvania, New Jersey. I'll tell you, Pennsylvania is dark orange on the eastern portion of the state and not as lighter orange on the western portion. New Jersey is orange the entire state. Delaware, the entire state. Virginia is orange in the northern part of Virginia. So what you can do is you can go to this website and kind of make decisions for yourself, for your family, and as leaders for your church congregation as to how effective, what is going on in my area, and they actually give a good guidance information as to, depending on what your area is, what type of activities and what type of things you need to do to protect yourself, your family, and your congregation.
Latasha, could I add to what Dr. Wesney has said? I want to be clear with the listening audience. I want you to put on your thinking caps right now. What has changed with this virus since we began to talk about it back in February? What has changed? It's like a dog in the yard. If the postman got bit by the dog last week, and a bicyclist got bit 2 days ago, and one of your neighbors walked in that yard and got bit by the dog yesterday, and now you have to go into that yard, that dog is going to bite you because the dog is still in the yard. And what I want you to understand, listening audience, is that Nothing has changed about this virus that would indicate that we are gaining ground on this virus in a way that we should be reopening. Clearly, some areas of the country are much less affected than other areas. But that doesn't mean that the virus, the dog, is not coming to your yard. It just hasn't come there yet. There's no fence between our cities and our states. And because population, the initial burst of this virus, but nonetheless, when you open up, you're exposing yourself back to this dog in the yard, and I promise you it will bite you. There are three things that have to happen for reopening to make sense. One, 60 to 70% of the patients or the population in the US must be infected. Right now, we have about 1.6, 1.7 million people who we know to be infected with COVID-19. But we have 330 million people in our country. So 60 to 70% of this population is about 270, 280 million people. In order to achieve about 60 or 70% of the US population, we need to get to about 280 million people infected. We're not there. We're at about 1.6 million. The second thing, that we need a safe and effective vaccine to be produced. That has not been done. The third thing, if we had a safe or effective drug therapy, that would also be useful, because instead of you having multi-organ failure, multi-organ disease, you would just have a virus like a common cold, and after 10 to 14 days, you'll feel better. Or we'll have a way to treat those who have severe disease and to keep the mortality low. We have a drug called remdesivir, and what it does simply is it reduces the hospital stay from 15 days to 11 days. It reduced the amount of death in the hospital for those who didn't receive it. It was about 11.6% of the patients died. It reduced it down to 8%. So 8% of the patients died on the drug. So we don't have an effective and safe drug therapy. So three things have to happen. 60 to 70% of the US population have to be infected. 2, we need a safe and effective vaccine. Or 3, a safe and effective drug therapy. None of those things have happened. So we're talking about reopening, and we're talking about now opening up in areas that had a little bit of infection. Guess what's going to happen? The dog is still in the yard, and the infection rates will rise. It will rise as what we call the second wave, and this will go into the winter when we have the flu, and now we will have COVID-19 and flu infections in the same vein, and we really won't know how to deal with those, because we won't know what virus is causing your headache, fever, and flu-like symptoms. And so we have a serious issue when it comes to reopening. I want our listeners to be very, very cautious. Nothing has changed, but since we understood this virus attacking us in February until now, nothing has changed that will result in us being able to have a safe reopening.
Thank you.
I want to add to what Milton said. The three of us, all members of the same church, we all go to Emmanuel Bricklow, and we have made it clear that we want to be sure, and this is the same attitude in the guidance that we're giving you as individuals that are listening to us today. We will not give you any guidance that will put you in a position where you could possibly become infected with this virus and lose your life. Our desire and our purpose is to give you guidance based on the best knowledge that is available out there today from the scientific field, and to give you guidance that will never put you in a position where you could lose your life. You matter to us. You matter to us because we love you and we care for you. So you can be sure that whatever we're going to give you is for the protection of yourself and your family first, not any other reason or anything else.
Thank you. Thank you for emphasizing that. Many of you may know that this is part of the team that's advising our administration. So a lot of the decision making is based on this concept of no lives lost. No church is worth reopening if it means we lose any of our members. So thank you for making that very, very clear. And, you know, I think we also need to understand too, that just because your state is opening and just because your state has certain phasing that they're doing, that doesn't necessarily apply to what we recommend for our churches and the safety of individuals. Now, I do have some questions that are coming in, and you know, we're getting close to the end, so I'm going to kind of have some quick fire questions just so we can tackle some of these. There's been some information that's come out about blood clots being related to this COVID-19 virus. What can you tell us about blood clots and if that has some impact on how it affects individuals?
Well, when we have the Cytokine Storm, there's a high level of immune cells as well as immune molecules that can push the body into a level of hyperclotting. In addition, added on top of that, the virus is also attacking the at least we know the kidney, which causes a effect on various molecules that are important in the clotting cascade. And as a result, we're getting a hyperclotting. People are getting strokes. They're getting what is called COVID toes, where the toes are having this red rash of small emboli that are in their toes and individuals' toes. And so this hyperclotting syndrome has to do with the hyper-inflammatory response that we're generating because of this virus.
Okay. All right. Now, what about, you know, of course, we're always looking for natural remedies for everything. Have any natural remedies been identified? Does vitamin C help? What are some of the things we can do to kind of ward off this thing?
Go ahead, Herb.
Well, I mean, for me to talk publicly on remedies that have not been proven scientifically is kind of difficult. That said, vitamin C, zinc, ginger, pineapple skin. I've heard all kinds of possible remedies. I can't speak to them, but I can say that doing all you can to stay well hydrated, getting a good balanced diet, with as much fruits and vegetables, which provide you natural minerals and vitamins, I think is a good thing. It's always been a good thing, and it always will. Well, I shouldn't say always, but I will say always. But I can't speak from a scientific perspective with regards to to these things. There may be others who can.
Okay.
Let me speak a little bit to that, Latasha. This issue of vitamin C and vitamin D, and Dr. Wesley made a very good point that we have to be hydrated and we have to eat a proper diet. But that's all towards when we're talking about wellness and healthy cells. Right now, we're talking about cells that become infected, and the virus turns off the cell's ability to respond properly to an infection. When I talked about the sprinkler system being turned off, the virus itself is going into your cell and turning off the normal response mechanisms that normal cells use when they are invaded by a foreign invader, a pathogen of this type. So the natural response system, when we're talking about utilizing vitamin C and vitamin D and those types of and natural elderberry and different things, those are in regards to well cells that can respond.
Right.
These cells have been altered by the virus. Your cells have been altered by the virus once it infects them. It cannot respond in a way that it used to respond because the sprinkler system, the mechanism, the pathway, without giving big words, but the pathway by which your body responds to that has been turned off. And so these types of therapies that we take that are naturopathic are very good for normal health. But here we're talking about a disease state where the cell cannot respond in the way it was made to respond. So we have to, the best way is to avoid this virus.
Natasha, you asked the question before this as well, that you asked about what's the best kind of protection. I'm just going to run that quickly. When you're out, especially in the store or you're going someplace, there are three things that you probably should have at all times. Gloves, and you need to know how to take them off and put them on, but get rid of them before you get back in your car, not on the parking lot, preferably in the trash. A face mask, okay? Even though most homemade face masks will not prevent the virus from penetrating, it will prevent droplets from getting on you. But the third thing, which is probably the best thing, is a face shield, which is really cheap. You can buy these things by the dozen online, but you put that face shield on, yeah, you're gonna look like somebody from outer space, but the droplets won't get into your eyes or in your nose and in your mouth and infect you when somebody's talking or near your space. So that's the best way you can do it. Have a face shield, a mask, and the gloves. That's the best protection you can use if you have to go out.
Thank you.
Can I make one quick comment?
Sure.
And that is, we haven't said this, and Dr. Brown has much more information on this, but I want to make sure we point this out, and that is there is a disproportionate burden of illness and death among racial and ethnic minority groups. That's us. And I just want to make sure that point is made. We could talk much more about that, but this is something that we need to, as Black African Americans, we need to be very cognizant of this.
Thank you.
Latasha, I want to make 2 points here. One on the point that Curry brought out on the protective gear. I want you to listen very carefully to what Dr. Curry said about how to take off the mask and put them on. But I want the listening audience to understand you can choose the level of protection that you want. For our physicians, for ourselves, for my family, we use N95 masks because they provide the highest level of protection. They're not easy to get your hands on them, but you should make efforts if you can to try to acquire N95 masks. N95 masks plus a face shield, as Dr. Curry said, and gloves, as Dr. Curry also mentioned, is the highest level of protection. The next level of protection will be KN95 masks with a face shield and gloves. The next level of protection will be the homeboy mask, where you just cover up like this, right? That type of mask, or a surgical mask with a face shield and gloves. And then the lowest form is just a homeboy or handkerchief or any kind of mask with gloves. That's the lowest form. So you can kind of choose based on what your resources are, the type of protection that you would want. It saddens me. I was in Ocean City this week, and I saw no one wearing masks. We were the only ones wearing masks. My sons and I, and my friend that was there. We were the only ones wearing our masks and our gloves in the locals were not wearing masks at all. It saddens me because while right now, that area has a low rate of COVID-19, it only takes one positive person to set a spark through that whole community. And I hope your listening audience will listen to this. In order for us to remain safe, please listen to Dr. Query, and please listen to Dr. Wesley about the importance of wearing personal protective gear and protecting yourself at the levels that I talked to you about. And that goes for our churches when we talk about reentry.
Yeah.
We're going to have to wear protective gear. Your church may decide not to wear the highest level, but in my sphere of people, we've made a commitment that no person, no church member will be infected or lose their life because of our reentry program. That's our standard.
Yes.
Now, some others may take another standard and say we're okay with losing some members in order for us to open up. But that's not my standard. And the two doctors that are here with me, that's not their standard either. We make a pledge, and we're pledging for our local area that no member or visitor who comes to our church will be reinfected by our reentry and reopening.
Thank you. Thank you for that. And we do have a lot of questions pouring in, and I know we're not going to be able to get to all of them. And we're so grateful for this information that you're sharing. Unfortunately, we don't get to hear it every week or as often as we watch the news. So the question is asked, how do we know which sources to trust? What do we follow as we go day to day? How do we know, we're watching the news, they're telling us one thing. We hope to have you all back to follow up at another time. But in the meantime, what are some reputable sources that individuals can follow for information that's accurate?
I hope you're recording this show that we're having today, because I believe that the information here provided they can go back and look at the information and write down the things that we've discussed for your own understanding. You have to understand, unless a vaccine is made, unless a therapy is made, or unless 60 to 70% of the community is infected, called the herd immunity, it's not safe. And so unless one of those three things happen, things have not changed.
That's right.
I want you to understand that. And they're good sources, but the information that we provided to you here is meant to help you understand what criteria you should use in order to keep yourself safe.
Thank you. And it has been very helpful. So I hope our listening audience is getting that picture. Nothing has changed. So no matter what you see in the news, no matter what's happening in your local communities, remember the situation is still the same and the precautions still need to be the same. Well, we want to thank you all once again for this afternoon, all the information that you shared. We want to give you an opportunity to give some final remarks before we close. Any other lasting remarks you want to stay in our minds as we exit? Anything else?
I'll start. I first of all want to continually wish our church family a blessed Sabbath. When you ask that question, what can we trust or who can we trust? We live in very unusual times. I encourage everyone to look up and look forward. From whence cometh our help. I do believe that we need to think about, as far as the question is concerned, independent sources, I would say, or people who do not have a vested interest in, it's so hard for you to even answer the question. because we're living in such unusual times. I tell you what I will say to you is what I've said to you. All three of us, we are concerned about our country, our extended family, our community. And what I've said and what we've presented is our honest, it's the honest truth. It's where we are. I'll leave it at that. God's blessing.
Thank you.
There's an old quartet song that says, if we ever need the Lord before, we sure do need him now.
Yeah.
Lord.
I think we lost him.
We must make a relationship with God. It's probably the most important thing. For information that's out there, the Centers for Disease Control, the CDC, has a huge volume of information on this. Very hard to pick through and find what you want, but if you're patient, you could probably find some information there that's good guidance. If you have any questions for us, please send them. If we can respond to you, we will happily respond to you to give you insight and information about what you request. Know that we love you and only have the best interest at heart for you. And may God bless you through the rest of this Sabbath. And we look forward to seeing you again in the future.
Amen.
To our listening audience, I just want to say we want you to be safe. Remember that the dog is still in the yard. Protect yourselves. There's going to be a second round of COVID coming in the fall, and we will be dealing with this present one for another 18 to 24 months. Please, please take this serious, protect you and your family, and God will see us through.
Amen. Amen. Thank all three of you for everything that you shared. And for those we didn't get to answer your questions, we're going to assemble those and present them to our team, and hopefully we can get answers to you. We're going to do our part as a conference to make sure we're continuing to update you with information that you can use to stay safe during this crisis. Thanks again, panel. We appreciate you once more. And thank you all for tuning in. We'll see you next time.
All right.